Chronic jaw pain can really disrupt lives. New technologies allow us to precisely control the relationship that our TMJs, teeth, and muscles share. The T-Scan EMG Link is one such technology. This video demonstrates its usage. Our patient presented with sensitive teeth, sore muscles in her jaw, in the back of her neck, and a self-reported uneven bite. A diagnosis of myofascial pain disorder syndrome, a type of TMJ disorder, was made after performing a thorough dental and TMJ examination. The patient was to receive disclusion time reduction treatment to help alleviate her symptoms. Before we were able to use the T-Scan EMG Link, we needed to run a digital joint vibration analysis on her to ensure that she had a stable set of temporomandibular joints. We then precisely adjusted her bite and indirectly her muscle activity levels with the T-Scan EMG Link, with the intent of balancing her bite and relaxing her chewing-related musculature.
Beautiful.
Describe again, if you would.
Oh, just the neck pains, and the soreness, the stiffness, jaw, like you said.
When, in the mornings, at night?
Throughout the day. I mean, in the morning specifically, I feel like a crinkle fry. But yeah, it's stiff, and throughout the day, it doesn't really ease up. And that's been more increasingly a problem.
The last year?
Mm-hmm, definitely.
About the time that thing stopped hurting? Is that
Like
fair?
a trade-off.
Yeah.
Yeah.
Your joint stopped hurting, then all of a sudden the muscles started
And
aching.
I thought it was the way I was sleeping, but I've modified it with pillows and things like that.
It
It's
didn't
definitely not
help.
that, no.
Yeah.
And
Okay.
massage and all that, it's not helpful, but
Okay, got it. So the pain in the muscles, show me where it is.
right. Well, this, like now, maybe it's this being on here, but I'm like, I feel it right here.
Yeah. What about, and you pointed back here too,
right along, like where the hairline stops.
Yep.
And it goes down the middle of my neck.
Got it.
All right, clench for me, please. And clench again.
It doesn't hurt. It's easy. And bite home. Open big. Bite home again. Open big. Okay, here we go for real. Bite home real hard. 1, 2 seconds. Go right. And open big. Beautiful. When you first start biting, you're skewed off to your right. Then you kind of clump together. And then you're hitting too far, too hard on your left side, which is right above your famous crown. So, I'm going to balance your bite.
Okay.
I'm going to make these forces work better for you.
Okay.
I'm probably, the only negative is I'm going to be probably grinding on your crown, which
Okay.
your brain is telling your muscles to make that speed bump go away that doesn't belong back there anyhow. So you're going to break it on your own.
Okay.
You'd rather have me precisely grind the spots. You see what I'm saying? It's not bad, is it? Yeah, see, remember this number 14 had like 20% before?
Oh, nice.
Now it's adjusted to 9, but look what shows up on 15. Another place, in the spike, you see the third dimension here, this little graph? Too much force in that part of the system. That's the kind of thing that throws you off. Feel different yet? I can't tell much yet.
Feels more like it's balanced. Because before, what I could honestly tell, I could tell that I was meeting this side and this side was not closing.
Right.
But now when I bite down, I can feel more even on those sides.
You're going to find as I progress, you're going to start feeling more up here, even to the front, which is what you want. When you go right, does it feel a little different now?
The whole bite does.
You see this line? Way in the beginning, you weren't anywhere near the center. You're more centered now. You're to the front slightly. We're already getting there. These numbers are starting to look about right. I mean, look at, for example, 4 to 9, 14 to 11, 11 to 7. I mean, they're not mirror images by any means, but they're better than they were.
Yeah.
See, like this one still needs a little work on 14. The goal is to have this little red line kind of snaking down and the kite's right about there.
Okay.
Now watching your muscles, I need to study this whole thing real quick to look at your muscles. See this SCM, we didn't relabel it, but it's trapezius. That's the back muscle, back of your neck.
Okay.
Let's see what it's doing. Side. Which side is really sore on the neck? Right or left? Or
No,
both?
they're both. Like, it's just really uncomfortable. So I couldn't really pinpoint one or the other.
It's okay.
It's like it hurts to hold my head up.
Seriously?
Well, no, like the other, like I was driving and I literally was trying to pop my neck. I was stretching, but it's
So tight.
yeah, and it's like a dull awful pain.
Understand. Feel like now.
Well, it definitely feels like all my teeth are touching.
Good.
That's what that feels like.
Right. Okay, that's fair. Okay, bite home hard. 1, 2, go left. Open big. Beautiful.
And that little squirrely intestinal looking line looks more like it's in the middle.
Yeah, he is, and he's forward. Like when
Do
you
you like my
bite,
description?
when you bite right now, it should feel great. I mean, it feels further forward, like your front teeth are touching.
No, that's exactly. I'm sitting here like,
Yeah. Yeah, this is honestly, I may not need to do much else. Let me look. Hang on. Good.
It's just weird because I'm not used to it.
Yeah, it'll take you a few days, sometimes a week or so.
I mean, it doesn't feel uncomfortable. I mean, it doesn't feel like, any weird like that. It's just different. 'Cause
The
I'm like,
muscles, your muscles are used to bracing because you weren't in the proper place. Now they're going to be more relaxed, so it's going to feel weird. It's kind of like you're used to doing this certain kind of motion. It's almost like you're batting right hand, now you're batting left.
Okay.
You know what I'm saying? Kind of
Training a
weird.
new muscle kind of thing. Or
Yeah.
training to do something different.
Training the muscle to do something other than what they're normally used to doing. It's the better way of putting it. Yeah, you're almost identical on those trapezius muscles now.
Wonderful.
Yeah, I'm be very surprised if this is not fixed. Okay, if your muscle's spasming, all these muscles are like a sling for your mandible, right? Your mandible starts relaxing, it kind of pushes, kind of releases and goes forward. It was contracted, the muscle, now it's relaxed.
Okay.
Does that make sense?
Well, my mouth feels better already just from what you've done.
How's
so.
the neck?
I mean, it feels good. I'm like,
it? For real?
yeah. No, I'm not making that up. Like, it really does feel.
Try to make it hurt.
No, I'm trying. I'm like. Yeah.
For real?
No, I'm not kidding. That's amazing.
Okay.
That's hilarious. I'm not even joking. I'm sitting here like.
She's got all these wires coming out of her. Okay, let's take the wires off. Let's make sure she still feels that way.
I know, right?